Good afternoon, everyone, and welcome to our Facebook Live with OrthoVirginia. I'm Dr. Owusu-Akyaw. I'm a sports medicine specialist here at our Schrader Road office. We're going to be talking about one of the most common reasons to have hip pain, especially in young athletic people, and that's femoral acetabular impingement or hip impingement, which can lead to things like labral tears and cartilage damage. Part of what we'll talk about is how we treat that for some people, which can involve physical therapy and can involve surgery, which is arthroscopy. So we're going to go and get into it here, learning about hip arthroscopy. Now, I get a lot of questions about this, so don't worry, I got you any details you need. And we'll even have a question and answer later to open it up. So let's start off with the basics. It all comes down to understanding vocabulary. So you hear the term arthroscopy a lot, or people say, oh, I'm having a scope of my knee, a scope of my shoulder. What does that mean? So let's break down the word. So the term arthro refers to a joint. The word scope, of course, refers to a camera. So you put it together, and what do you get? You get arthroscopy, which is referring to using a camera inside of a joint. So arthroscopy is using little tiny cameras and small tools to do minimally invasive work inside of various joints. Now, like I said before, that could be various joints like your knee, your shoulder, elbow, wrists, almost any joint you could think of. Today, I'm going to be talking about hip arthroscopy, so doing those minimally invasive type surgeries inside of the hip joint. Let's check the next slide out. So, hip arthroscopy, minimally invasive surgery inside the hip. So how is this done? Well, the hip joint is one of the strongest joints in your body. It's congruent, meaning that the ball and socket of your hip joint fit together very tightly, and it can be hard to get inside of it. So to get inside of the hip with our special tools, we sometimes, or really frequently, have to pull a little bit of what we call traction on the hip and almost pull the ball out of the socket just slightly during surgery so we can go inside and do our work. Now, I know that sounds traumatic and it's a tough process for the patient for sure, but for one thing, they're always asleep for that part. Secondly, here at OrthoVirginia, we're the first in the area to utilize the Stryker Pivot Guardian table, which allows us to do this in a less traumatic way, utilizing a combination of friction and gravity. So that's a picture of that on the right. The patient is laid on the table and putting their body in kind of in a tilted position so their head is kind of down and their legs are up. We can very carefully and gradually ease that hip joint slightly out of socket just so we can work inside it and do what we need to do in a much less traumatic way than it's been done in the past. Still a big deal, but we can make it easier on the patient, which is always the important thing. Let's go next slide. So for us to understand hip arthroscopy, I got to go through some of the basic anatomy for you. I got some bullet points on the left so you can follow along with the pictures on the right. Let's start with the hip joint itself. Like I said before, the hip joint is a ball and socket. So simple ball and socket joint, just like you might see in any other situation. The ball fits in the socket and it moves together congruently. It's supposed to. So what makes up that ball and socket? We'll look at the picture on the right so you can see where the ball is sitting in the socket. That ball, so to speak, is the femoral head, the top of your femur bone. The femur is the thigh bone, and it comes all the way up to the top of where your hip joint happens, and it becomes kind of a ball on the end, and that sits inside the socket, which is the acetabulum. The acetabulum is a part of your pelvis, and a lot of people who say my hip hurts are actually pointing at their pelvis, right? Hands on your hip on the side, that's actually your pelvis. So your pelvis actually comes down and becomes the acetabulum, which forms the socket of the ball and socket. In between that ball and socket is the cartilage. So in this picture here, you have it in purple. That's kind of showing you where that articular surface of the cartilage is. Think about when you have like a chicken bone, that gristle on the end that's kind of smooth, that's your cartilage. It's sort of like a bearing surface in between the joints, so it helps the whole thing to move smoothly. So it's not bone on bone, as people say. That cartilage in between is very important to keeping your hip joint healthy and moving smoothly. Now the hip labrum is a special type of cartilage that goes around that ball and socket. It's almost like a gasket or like a suction seal. It's meant to be holding that joint and steady and in place. And again, that's a special type of cartilage. It's not the same cartilage that you have, for instance, that's on the end of the joint. It's kind of a tougher, rubbery cartilage, and it's holding a suction seal. On the picture here, that's that light blue picture, the light blue structure. So it's going around the ball and socket, and it's meant to hold things down in place. Now that we have the basics kind of in place, we can talk at a more level or a higher level about what it means to have to fix something inside the hip joint. Let's go next slide. So one of the most common reasons for a young athletic person to have pain in the hip is something called hip impingement. That's also one of the most common things that we would actually try to work on or fix via hip arthroscopy. So hip impingement is also called femoral acetabular impingement, or FAI. And that's kind of a complicated sounding word, but once again, if we break it down into its pieces, we can see how it all makes sense. So femoral refers to the femur, which is the ball. Acetabular refers to the acetabulum, which is the socket. All right, so ball and socket. And then impingement refers to sort of a pinching. So basically what you're saying when you say someone has hip impingement or FAI, the ball and socket is set up such that there's some pinching occurring. Now, why does that happen? Well, look at these cartoons on the right. So at the top right, you can see what a normal ball and socket articulation looks like. See how the ball and socket fits together nice and smoothly? When you have that situation, the ball and socket will move smoothly and you won't have any problems with your range of motion. Now, there are several types of hip impingement that can occur. A cam impingement on the bottom left is where there is an irregularity of sorts on the ball, on the femoral hip. And so that stops the hip from moving smoothly because that irregularity tends to bump the socket, and that can actually stop motion and cause stiffness, or in some cases cause damage to the joint itself, which we're going to go over in just a little bit. Now, on the other side, you have the pincer type impingement, which is sort of when it's on the socket or the acetabulum. In that case, there's some irregularity or a bump of bone of such on that socket side, right? And so when that ball tries to move, it bumps into the socket because of that pincer. And in between that is the cartilage, which gets impinged or pinched. So a complicated sounding word, but if we break it down into its pieces, it's easy to kind of understand the concept. Femoral acetabular impingement, the ball and the socket don't fit quite right together, therefore it causes pain and damage in the hip. On to the next slide. So this goes hand in hand with another common term that you may hear. We talked about the hip labrum. You probably or may have heard about someone having a hip labral tear. So that labrum, being like any structure in the body, can be damaged or injured. So look on the left, you can see a normal looking hip ball and socket. The labrum is in light blue and it's holding like a suction seal on that joint. Now that's great because it's causing maximal stability of your hip, and your hip being a stable joint, important for most of your functions during the day. It's important that it be stable. So you might imagine injury to the stability of your hip will affect a whole lot of daily function. When I say daily function, I mean things like sitting, standing, walking, certainly running, and certainly like sports activity. So if you look in the middle picture, if someone has a tear of the labrum, it tends to tear in a lot of cases away from the bone of the socket, just like that picture shows in the red. When it does that, you can imagine you lose that suction seal on the joint. Losing that suction seal can create a micro instability for a lot of patients, where in the hip joint, it's not gonna like slide out of place, so it's not fully unstable, but it's kind of shifting around more than it should, which causes pain throughout the entire system. And oftentimes feels like pain up and around the front of the hip, sometimes around to the back of the hip, even causing some people like hamstring or lower back pain. Everybody's different there. So in some cases, and we'll talk about this soon, we have to end up fixing this labrum. And we do that, again, arthroscopically, using the small camera and tiny tools through 3 small holes, where we go in and we actually put anchors or tiny little screws into the bone of the socket that have stitches coming out. Those stitches then go around the labrum, we anchor it back into the bone to hold it in place, and then we have a restored suction seal. Next slide. So the big idea that I need you to take away from this is that hip impingement and labral tears have a tendency to go together hand in hand, okay? So if someone has pain from a hip impingement, a lot of times that pain is related to the impingement itself and also to the injury to the labrum or the cartilage in the joint. So hip impingement and labral tears frequently go hand in hand, especially if you're dealing with somebody who's very active, who requires their body to do a lot of active flexion of the hip, crouching, squatting, and that sort of behavior. So let's do the next slide. So if you take one thing away from this presentation today, though, despite everything I've said about what an arthroscope means and how it's a minimally invasive surgery, I want to tell you that most people in a situation like this do not end up needing surgery. Do not. So many people will have labral tears and even signs of impingement, and they don't need to do surgery. We always try everything else first because surgery has to be a last resort. So I get a lot of questions like this. So doc, if my labrum's torn and I have impingement, how is physical therapy gonna help me? How's anything else gonna help me? Well, here's what I wanna break down for you. Look over here on the left. So we see a picture of the ball and socket. You've seen it a few times at this point. Should be easy now, it's butter. The gluteus medius, along with many other muscles around your body, especially around the hip, are meant to act as stabilizers of your joint. Now, why is that important? Like I said in the last slide, a lot of times the pain from having a labral tear and impingement comes from micro instability. So to make the pain go away, we got to make your hip stable. Now, surgery is one way to do it, but most people can do that by strengthening the muscles around your hip, in particular the gluteus medius, to stabilize the hip joint. Think of that gluteus medius as the lighthouse of the hip, right? It stabilizes your pelvis, it stabilizes your hip ball and socket. It helps your entire leg to move more efficiently. Frankly, it's a very undertrained and underutilized muscle for a lot of us because in our society, we do a lot of sitting, so we don't activate that muscle a lot. So when people come into my clinic and they may or may not have, say, an MRI or something that says you have a labral tear, one of my first questions is always, well, have you tried physical therapy? And the reason why is because most people, if they focus on strengthening this muscle, can make the pain go away. Now, does that mean the labral tear goes away or the impingement goes away? Well, no, not necessarily. If you got a new MRI in a few years after that, you probably will still have a labral tear. But if you feel better because you strengthened this muscle effectively and you made it so your hip joint is solid and strong without having surgery, then the MRI findings don't matter so much as how you feel about it. So if I gave you one thing to take away from today, is that gluteus medius strength is the key to hip mobility and function long-term. All right, next slide. Now, for some people, and like I said, the minority of people is going to come to surgery. Now, last year we did a little surgical demonstration on hip arthroscopy, and it was pretty popular, so we're gonna run that back. But I want to give you a quick alert that we're about to do a little video of surgery. So if it's something you don't want to see, this would be a good time to turn off your screen or look away. I'll give you a couple seconds to get away. All right, let's get it. So we're gonna start with the labral repair. So right now we're looking inside the joint of the ball and socket, and you see that ring of cartilage going around, that's the labrum. And I'm working around it right now to get the bone prepared next to the labrum on the socket. I'm doing that so that when I put my anchors in, which I now have in, I have stitches coming out that I can then tie back into the bone. And because I cleaned the bone up beforehand, it'll release kind of healing cells that should allow that tissue to heal back into the bone. So I do that for as many times as it takes. So in this case, I ended up putting in 3 anchors to fix this person's labrum back in place. And here I am tying the second anchor down. So you get a nice restoration of the labrum there. So now it's stuck to the bone just like it should be. And in a second, you'll see me do it again. There we go. So we're doing the same sort of thing. Now this is working again through tiny little holes using the camera in one hand and the tools in the other hand. I have my trusted assistant, Sherma Francis, next to me when I'm doing these surgeries, and she helps make this thing go smoothly. And these skill sets are kind of like a video game. Our video game kind of relates to this in that you're having to look at a screen as you work, but still be using your hands. So here we are, we're gonna do it one more time. So my probe there is showing us that we have a tear of the labrum. I'm cleaning up the bone right above the labrum so we can have a nice surface for it to heal to. Once you got it nice and clean, I put in the anchor now at this point. I already did the part, you didn't see that. But the stitches come out of the anchor, and then I tie those stitches down in place to hold that labrum back where it's supposed to be. Now, last year we did a different type of anchor, and that's when that was called a knotless anchor, where we actually put the stitches first and then put it into the anchor of the screw. Both ways are fine. In this case, we use a type where we had the stitches coming out of the screw in the first place. And that's really just a style difference. So they're different, just like anything else, there's different brands of like Kleenexes and stuff, right? So same kind of thing. So here we are putting down the next to the last anchor. And so you can kind of compare side by side. I've got video on the left, you've got the cartoon on the right. You can kind of see the concept of what we're doing here, because I know it gets disorienting. But once we finish with that last stitch, we now have a nice restoration of the labrum there. So that's dealt with the labral tear. So that's part of the problem. But remember what I told you, what goes hand in hand on that big idea slide, hip impingement and labral tear. So let's go to the next slide. Let's talk about the hip impingement. So as you may recall, that hip impingement relates to having kind of an abnormal shape of the bone. So here we are, and I'm actually smoothing out the bone of the ball in this picture. So if you wanted to find the ball and socket again, that would be to your left on this picture. And I'm using this tiny little rotor, we call it a burr, that's basically shaving away the bone until it's nice and smooth, just like that. So once I finish, I want to see what was a bumpy surface nice and smooth. Now what I'm doing now is one of the most important parts as we come to learn about hip arthroscopy. Now, every joint in your body has something called a hip capsule. That hip capsule is like a saran wrap that holds it in place. In the hip, that capsule is so thick, we actually have to make a purposeful cut oftentimes in it to get into the hip joint. As we learned more and more about hip arthroscopy, we learned that it's very important to close that hip capsule when you're done with the surgery. And while some years ago that wasn't necessarily done routinely, we now do it pretty much every time it's important. So the process you just saw me doing was actually putting stitches across that cut in the capsule and tying it back in place. So now you can't even see inside the hip because I've closed it up. I'm about to run it back again so you'll see it. There it goes. So again, you're expert by now. We're looking at the hip impingement. I'm using that burr, a little rotor, to smooth that bone out very meticulously and taking our time to do a nice job. We try to get it from every angle we can. So we look from both angles around the hips. We make sure we don't leave some bone that needs to be smoothed out. We get us a nice smooth surface just like that. That's what we want to see, like butter. Same thing going down the other side of the head. Now back to it, we're talking about the capsule repair. So there's a small cut we made in the capsule so we can see into the joint. If you look down deep in the picture, you can see down where the joint is where we're doing our work, right? So we use a special suture passer instrument to pass those stitches up and through the capsule, making sure we get the full depth of that capsule so that when we finish, we can close it up nice and tight and it's exactly like it was when we came. Always leave things the way you came in. That's what we say in surgery. So we clean it up, we tie down those stitches, we get them right where they need to be, we get that capsular tissue back together. We call it approximated, but basically back in place like it was before. Try to make it like we were never there. All right, let's go next slide. So let's break down hip scopes, steps 1 through 4. Step 1, the most important thing I taught you today, only last resort. And that's pretty much the case for all surgery. Unless it's an emergency or what have you, surgery is the last resort. Nothing else is gonna work for us. If we're doing surgery, the 3 steps, 2 through 4, that are important, deal with the labrum, usually fixing it, fix the impingement, close the capsule. We wanna make sure we have a nice, stable joint whenever we're doing this surgery, and that's the whole key. So at the end of the day, our goal is to restore hip stability. And if that's done through conservative measures, then that's excellent. If it has to be done through surgery, then that's the last resort, and we'll do an excellent job with it. So that concludes my formal presentation. I think we have some questions that we can take a look at. Is that right?
Yes, we do have some questions. We will be answering questions that you submit now. So please go ahead if you're watching this live and leave some questions in the Facebook comments. We will also be answering questions that were submitted ahead of time. Not all questions will be able to be answered, but we'll get through as many as we can. So our first question is, can a hip arthroscopy treat arthritis?
Okay, that's an excellent question, a very important point. Let's start off with the basis of arthritis. Okay, so what is arthritis? Well, break down the word first. Arthro, that's the joint. Itis, inflammation. So you break it down as inflammation of a joint. Now, most commonly when we're talking about it, we're talking about a loss of cartilage inside of the joint, that articular cartilage, the bearing surface. Okay, so when people might colloquially say things like bone on bone, they're saying your cartilage is completely gone and the bone is touching the bone. So if someone has arthritis, hip arthroscopy does not work. Once you start to lose your cartilage, you get to a situation where even just fixing your labrum or smoothing out your impingement is not going to give you long-term relief of your pain. It's very difficult for you and your body to differentiate between pain from an impingement and pain from arthritis. So one could, for instance, theoretically go do a scope on an arthritic hip and fix their labrum and do all this impingement thing I just taught you, but they would still have arthritis because there's no way for me to get your cartilage to come back. Once it's gone, it's gone. So you would still have pain in your hip. So hip arthroscopy is not a recommended surgery for arthritis of the hip.
Thank you. Is there an age limit for hip arthroscopy?
That's another great question, and it kind of segues nicely from the first question we just had. So hip arthroscopy does not have a standard age cutoff per se, not by number. But the thing we need to realize is that the older we get, the higher the risk of you having degeneration of your cartilage or arthritis, which, like I just said, if you have arthritis, having a hip arthroscopy is not such a good idea. So for that reason, it tends to be in people who are under the age of 50, most typically. Now, that being said, there are people who are older than that who have no arthritis but tear their labrum, or have impingement. In which case, if you don't have arthritis and this is something that's causing you pain, and once again, you've tried everything else that you could possibly try, then it's possible it may work for you. But it's not so much about age as it is about whether or not you have arthritis and what's your functional level. So if you're someone who has a level of function that the pain is stopping you from living your life and you don't have arthritis, even if you're over the age of 50, you may have a good outcome. So it's not about the age, it's about the person.
Thank you. What is the recovery like from a hip arthroscopy? How long do you miss work? Do you need physical therapy? Anything like that?
These are great questions. So this is a very individualized thing too, but let me give you the basics based on the averages for people. So recovery from a hip arthroscopy, the full recovery, I would call from 6 to 12 months. Now, when I say full recovery, what I'm saying is, for instance, if you played a sport, like return to sport timeline. To be able to walk around all day, living your life, for most people, that can happen at like 3 months, right? But the recovery in terms of making steady improvement tends to take something like 6 months to a year total. Depending on what you do for work, that may change how long you're gonna miss work. So if you do more of like a desk job, most people can go back after like 2 weeks after a surgery like this. If you're doing something that involves some standing, sitting and standing, kind of alternating, kind of like my job, 6 weeks is more likely. If you have to do like heavy lifting, climbing ladders, running, jumping, anything like remotely like that, climbing on roofs, anything like that, that's more like 3 months. And that's like lifting over 30 pounds, that's 3 months. So we want to make sure you have adequate recovery to protect yourself before you do anything that's more strenuous. So how long you're out of work depends on what you do for work. You do need physical therapy, and that's a very important component. And the point we made about the gluteus medius is important for after surgery too. A large part of making it through, the rehab from surgery like this is to strengthen that gluteus medius to facilitate the whole thing. So what I'm going to tell you is that surgery and physical therapy go hand in hand. And those patients who are able to routinely stay on top of the therapy and stay on top of their strengthening tend to do better afterwards.
Thank you. Can the gluteus medius be torn or anything like that might interfere with strengthening it and prevent you from having use from physical therapy?
Absolutely. So the gluteus medius can be torn. It can be torn a few different ways. So it can be torn because of a traumatic thing, like something happens to you, you fall, get injured, something like an accident. Or more commonly, it's one of these things that can tear just over time. We call that degenerative or chronic. So for some people, it's just something that happens, you can call it wear and tear with life. Now, in most cases, a gluteus medius tear is kind of like a partial tear. So if you think about like a rope, if you were to take a rope and start pulling on it and pulling on it, pulling it and start to fray, right, and kind of come to pieces, that's kind of what I'm talking about when I'm talking about a chronic degenerative tear of the gluteus medius. In most cases, that's what the situation is. Now, in some cases, you can have a full tear of that gluteus medius, where it actually tears off of the bone on the side of your hip. That bone is called the greater trochanter. It's part of your femur, actually. When that tears off completely, in some cases, it makes sense for us to actually do a surgery to fix that in place. But if it's more of like a partial tear, there's other things we can try first. Like I said before, certainly physical therapy. Certain types of injections can come into a role too. That's a whole nother discussion. That needs its own Facebook Live, to be real with you. But to answer the question, gluteus medius can be torn, and that certainly can interfere with recovery if it is an issue.
Thank you. Are there exercises or activities people can do to help prevent a torn labrum?
So that's another good question. I'm going to reframe it just a little bit. So it's difficult to prevent a torn labrum because a torn labrum happens to a lot of people just because. So what you can do is strengthen that gluteus medius and strengthen those hip stabilizing muscles to make it so your hip is stable, so that even if you have a torn labrum or if you get one, it doesn't bother you. So to prevent you from ever tearing your labrum, it's hard for me to say that would happen. However, the more mobile and strong you keep your hip joint, that's the more the chance that you don't have pain from a labral tear if it happens to you, which is really the goal. So strengthening the hip functional stabilizers, gluteus medius, minimus, hamstrings, core muscles, hip functional mobility, working on these exercises is important to your overall health in general, and it can prevent you from having a symptomatic labral tear or a painful labral tear.
Thank you. how do you tell the difference between hip arthritis and impingement? And if you'll need a hip replacement or a hip arthroscopy?
Excellent question. So let's start with the first thing you do when you see a doctor. What's supposed to happen is you have a physical exam. So they do some tests on you. And the person who asked this question made a very important point. So when you do the tests to move somebody's hip around, the same things that would hurt for hip arthritis and hip impingement would look the same. So what I'm saying is the same test that would test to see if your hip is hurting from those two things on just an exam will look very similar. It'll be hard to tell the difference. And that's where imaging comes into play. So the two imaging things you hear about most commonly are what? X-ray and MRI. X-ray, of course, shows the bone and the alignment of the bone. MRI shows the bone too, but really shows the soft tissue in the area. So that imaging study helps us to differentiate. So if you get an X-ray of a joint and someone has a loss of space in between the ball and socket on the X-ray, right? That bone-on-bone discussion. If you lose the space in between the joint, even though you cannot see the cartilage on the X-ray, you can see where the cartilage should be. So if that space is gone in between that joint, then you're looking at some bad arthritis, in which case an arthroscopy is not the move. In that case, a hip replacement may be the move if you're to have surgery. But remember, again, this is the last resort situation with any surgery. So it might be we need to try some other things first. But as it pertains to surgery, if you're bone on bone, you've lost enough cartilage, then the discussion is about hip replacement. If you have pain in your hip with no arthritis, well, there's signs of hip impingement, or if you have an MRI and it shows you have a tear of the labrum along with that hip impingement, and you tried everything else, that's when we talk about doing a hip arthroscopy. So the pain that you look at when you see someone can be similar between these two things. And that's where it's important for us to be kind of on alert to get the right kind of imaging studies to know which is which so we can treat appropriately.
Thank you. So you said arthroscopy comes from the words meaning joint and camera. So is it still an arthroscopy if you're using tools to fix something, or does arthroscopy just mean that you're looking inside and there's a different name for fixing it?
That's a good question. So the arthroscope refers to just the act of looking at it. Now, we very rarely just go inside and look. We pretty much are always working when we do something. And so typically when you're talking about an arthroscopic surgery, you use that as like an adjective. So if you are doing a labral repair, you would say you're doing an arthroscopic labral repair. So that's indicating you're using the small camera to look inside, or you're using the tools to do the repair. So therefore it's an arthroscopic labral repair. If you're doing something in the knee, let's say you tore your ACL, you're doing an arthroscopic ACL reconstruction. You see, so the arthroscope does refer to the camera and the minimally invasive aspect of things, but then usually use that to describe what you're going to be doing when you're in there. Because you don't typically go in there just to look. Usually you're trying to deal with something or fix something.
Thank you. Can taking anti-inflammatories to reduce pain during exercise potentially cause damage by masking the pain that is in there?
So it's possible. That's kind of a controversial point. So certainly anti-inflammatories can make you feel less pain when maybe something is going on at the joint. Now, to do enough of something to cause damage to your, like true irreversible damage to your joint, it'd be hard to mask with anti-inflammatories. It would take more than that to not feel the pain. So I guess what I'm saying is if you were causing damage that was really irreversible on the joint, it'd be hard to just take like a Tylenol, like an ibuprofen or Advil and not tell that was happening. But that being said, it's not a good idea to use anti-inflammatories to just like push through pain. They can be thought of something like get you over a hump if you're having a really tough time. But if you're having to take it on a regular basis just to get through something, it's probably a good idea to have things checked out and not to be pushing through it. So the question asker had a very good point there.
Thank you. If you have osteoarthritis and a confirmed impingement, are you at more of a risk to tear the labrum?
That's another great question. So if you have osteoarthritis and a confirmed impingement, it's most likely your labrum is torn. Now, labral tears need to be considered in a few different buckets. So there are some labral tears that are kind of like clean cut labral tears like I showed you in the pictures, where it's kind of the labrum is intact but torn from the bone. And that's kind of a more acute thing. When people have arthritis, they tend to have degenerative tearing of that labrum. So just like the same thing I said about the rope fraying with the gluteus muscle, that can happen with the labrum. So if someone has arthritis and hip impingement, they probably have degenerative tearing of their labrum. So here's an example that might help. A lot of times people will have an MRI, and the MRI will show they have arthritis, and they'll also have a labral tear. And so it'll come up that they'll think that, well, maybe I need to have my labrum repaired. But in that situation, the labral tear is part and parcel with the arthritis. The arthritis and the labral tear are one thing. The cartilage is degenerated in the joint, and that labrum is degenerated along with it. So in that case, fixing the labrum wouldn't fix the problem because they have arthritis, and secondary to that, they have a labral tear. So we need to remember, that there's different types of labral tears, and there are different kind of reasons for someone to have pain because of one. It's one thing to have, hip impingement and a labral tear with no arthritis. But to have arthritis means that a lot of these things kind of become part of the problem, but arthritis is the central issue.
Thank you so much. That is all of the time that we have for today.
Right.
Dr. Owusu-Akyaw, would you like to close?
So if I gave you one thing I want you to take away, is that there's an importance to strengthening and functional strength and mobility around the hip joint. I like to think of the hip as kind of the lighthouse of the body. And I tell people all the time that hip mobility is tied to longevity. The better your hip mobility, the better you can do daily activities, the better you can function, exercise, what have you. So it's very important to try and make that part of your daily life and try to avoid people seeing people like me if you can. Now, if you have to, we're always happy to help. But the best way to stay ahead of these things is to be preventative, of course.